mediastinum. What exactly we mean by the word mediastinum? The Latin meaning of this word is intermediate, something that is present in between. Now in the thoracic cavity, we have two lungs, the right and the left lung. In between the right and the left lung, you have got space present which is called as mediastinum. And generally when people ask, what is the most important constituent or the component of the mediastinum that is present? So immediately we say heart, that is present in the pericardium. That is the most important organ. Yes, 100% it is very important organ. Also we have got some more important structures that we are going to discuss. Okay, so just let us now learn about the mediastinum. What are the boundaries? What are the divisions of the mediastinum? So first what we are going to learn? Boundaries. Then we are going to learn about the divisions. Okay, just let us go starting the diagram of the vertebral column. Now you know this is T1, T2, T3, T4. Okay, then you have got T5, T6, T7, 8. Okay, like that up to 12 you are having the vertebral column. Please understand, in between the vertebrae, needless for me to tell because already you know, now we have got the intervertebral discs that are present, okay, up to T12. Are you understanding? And then, here anteriorly, we are having, so how to draw this diagram is from T4, okay, come anterior, imaginary horizontal line is drawn, which is cutting or which is reaching this portion between the manubrium of the sternum and the body of the sternum, which you have learned, that is nothing but a sternal angle. Okay, and here you have got the xiphoid process, and here we are having having the xiphoid process. We will make the body little bigger. This is the lateral view of the sternum. What you are seeing is, and here is the xiphoid process. And here this is the diaphragm, which is the musculo-tendinous partition of the trunk. The trunk is divided into upper thorax and lower abdomen because of this diaphragm. Okay, and here if you see, this is the manubrium of the sternum. So this is called manubrium. I hope you can understand. This is the lateral view. You are seeing laterally. Okay. Now anteriorly what you have? You are having the sternum. Now posteriorly what you are having at my back? You are having posteriorly the vertebral column. So this entire portion is called mediastinum. Okay. And here this is oblique and this is called plane of inlet of thorax. This is called plane of inlet of thorax. Are you able to understand? Now, shall we start learning the boundaries? Anteriorly, what is present? Obviously, you have got, now anteriorly what is present? Anteriorly, you have got sternum, right? Now, posteriorly, what is present? Vertebral column. Yes, the vertebral column is present posteriorly with the 12 thoracic vertebra and the intervening intervertebral discs. Superiorly, what is present? Superiorly, you have got the inlet of the thorax, and inferiorly, what is present? Inferiorly, you have got the diaphragm. Inferiorly, you are having the diaphragm. Superiorly, you are having the inlet of thorax. Are you able to understand? So these are the boundaries of the mediastinum. And what are the divisions of the mediastinum? This imaginary line which is drawn from the sternal angle to the lower border of 4th thoracic vertebra. This imaginary line which is drawn from the sternal angle to the lower border of the 4th thoracic vertebra is dividing the mediastinum into superior mediastinum and inferior mediastinum. Okay, so you have two divisions of the mediastinum, superior and inferior. Again, the presence of the heart in the pericardium is dividing this inferior mediastinum into, this is the middle mediastinum, this is the anterior mediastinum, and this is the posterior mediastinum. Are you able to understand? Now what are the divisions of the mediastinum? If they ask you, you should tell. Basically the mediastinum is divided into superior and inferior mediastinum by an imaginary line that is drawn horizontally or transversely starting from the sternal angle anteriorly to the lower border of fourth thoracic vertebra posteriorly. That's what we will tell. And below this line, we consider that portion as the inferior mediastinum, which is further divided into three divisions. What are they? Namely, anterior mediastinum, middle mediastinum, and posterior mediastinum. Now, what is dividing the inferior mediastinum into anterior and posterior? The presence of heart in the pericardium. Heart, along with its pericardium, where it is present, is called the middle mediastinum. Anterior to it is the anterior mediastinum. Posterior to it is the posterior mediastinum. Now let us quickly revise. About the mediastinum. Mediastinum means something which is present intermediate or in between. In the thoracic cavity, in between the two lungs, we have got space present which is called mediastinum. The most important component of this mediastinum is the heart. Also we have got other few important structures. Yes, not few, many important structures we are having. We will be discussing about them in great detail. But just let us now understand what are the boundaries of the mediastinum. So, if you see, this is anterior and that is posterior. So, posteriorly you are having the vertebral column, anteriorly you are having the sternum. Inferiorly we are having the diaphragm, and superiorly you have got the inlet of the thorax. Now, superiorly what we are having? The inlet of the thorax. So, this entire portion is called the mediastinum. Okay. Now, coming to the divisions. A transverse line, an imaginary transverse line which is drawn from the sternal angle to the lower border of fourth thoracic vertebra is dividing the mediastinum into superior and inferior mediastinum. This inferior mediastinum is again divided by the presence of heart in the pericardium into anterior mediastinum, middle mediastinum, and posterior mediastinum. So we have got three subdivisions of the inferior mediastinum because of the presence of the pericardium and heart in it. Let us learn about the superior mediastinum. Last class we have learned about the mediastinum. Just briefly we will discuss the boundaries of the mediastinum. Okay, we said anteriorly. Okay, now anteriorly we have the sternum. Posteriorly we have got the vertebral column. Inferiorly there is diaphragm, and superiorly there is inlet of thorax. So what you are having? Superiorly inlet of thorax, inferiorly you are having, this is the diaphragm, and posteriorly the vertebral column with the 12 thoracic vertebrae and the intervening intervertebral discs, and we also have anteriorly the sternum. On either side the mediastinum is having the mediastinal pleura. On either side it is having the mediastinal pleura. Okay, I think this point we have missed in the last class, so that you can now learn. Okay, on either side you are having the mediastinal pleura. Okay, now coming to the superior mediastinum, we said the mediastinum is divided from the sternal angle, that is the Manubrium joint. This portion of sternum is called Manubrium. Starting from the Manubrium sternal joint, this is the body of the sternum. So starting from this sternal angle, we draw a horizontal line which will extend to the lower border of the fourth thoracic vertebra, dividing the mediastinum into superior and inferior mediastinum. So now let us focus only on the superior mediastinum. Now if somebody asks you, tell the boundaries of superior mediastinum, what will you tell? Anteriorly, what is present? Anteriorly we have got the Manubrium. Posteriorly, what you will tell? Posteriorly you have upper four thoracic vertebrae, okay, T1 to T4 with intervening intervertebral disc. And superiorly what you have? Superiorly we have got the inlet of thorax, okay, and then inferiorly what you are having? Inferiorly we are having this imaginary line that is drawn starting from the sternal angle anteriorly to the lower border of the fourth thoracic vertebra posteriorly. So this imaginary line is forming the inferior boundary of the imaginary line. This is the imaginary line which is forming the inferior boundary of the superior mediastinum. So this entire portion is called superior mediastinum. Again and again, it is very important for us to know about the superior mediastinum, about its contents. We have just finished the boundaries. Why again and again? Why it is so important? We will be learning in great detail, because there is a clinical condition called Mediastinal Syndrome. Mediastinal Syndrome is a clinical condition wherein the patient who comes to you will present with all the problems of the planet Earth. You are understanding happening to him. Now we will learn that what is the problem. Okay? Now for that, let us go with the contents of the superior mediastinum. Now let us try to draw the reflection of the pericardium. Okay? The reflection of the pericardium I am drawing. Good. Now you see, we have got the arch of aorta. Now this is the arch of aorta I am trying to draw. Okay? Here you have got the brachiocephalic artery, the common carotid artery and the subclavian arteries arising from the arch of aorta. Okay? So what you are having? The brachiocephalic artery, the common carotid and the subclavian artery that is present on the left side. The subclavian artery, common carotid artery, and the right side you have got the brachiocephalic artery. Okay? Now we have got behind trachea. Okay? Here we have the trachea and the tracheal rings. We can never forget, when you are drawing trachea, you are going to draw the tracheal rings. And behind that we have the foot pipe. What is that? Esophagus. Good. So here we are having esophagus. So here we have the trachea and here we are having the esophagus, and we have got the veins. What are the veins? The left brachiocephalic vein, the right brachiocephalic vein, and here we have got the superior vena cava. So this is the superior vena cava what you are having. This is the right brachiocephalic vein, the left brachiocephalic vein. Are you understanding? So these two unite to form the superior vena cava. Now this is the right side. We are trying to talk the right side of the superior mediastinum. Okay? And on the left side we are having more arteries on the left side of the superior mediastinum. Then coming to the nerves, here we are having nerves. What are they? They are phrenic nerve. Okay, one is the phrenic nerve, the left recurrent laryngeal nerve. Here we have got recurrent laryngeal nerve. You know, between the trachea and esophagus there is a tracheoesophageal groove, and in the tracheoesophageal groove we have got the left recurrent laryngeal nerve. We also have got the vagus nerve. So you have got phrenic nerve, vagus nerve, and of course the cardiac plexus of the nerves are also present. The phrenic nerve, recurrent laryngeal nerve, vagus nerve, and the cardiac plexus of nerves. We also have muscles, the origins of sternohyoid, sternothyroid muscles. You know, from sternum to the hyoid bone, from sternum to the thyroid cartilage. Sternohyoid, sternothyroid. These are the muscles. Okay. So the muscles what you are having, muscles, these are sternohyoid, sternothyroid. Also we have got the ending portions of longus colli. So there is muscle longus colli. So the terminal portion or the ending portions of the longus colli is also present. So we also have thymus, very important, thymus, thoracic duct, and lymph nodes, which are all present in the superior mediastinum. So we are having what? Thymus, and then we are having thoracic duct, okay, and then we are having the lymph nodes. So different lymph nodes are there, that is paratracheal lymph nodes, bronchomediastinal lymph nodes, brachiocephalic lymph nodes. Okay, so we have got paratracheal and then the bronchomediastinal and the brachiocephalic lymph nodes. Are you understanding? Let us quickly revise about the contents that are present here in the superior mediastinum. So we will begin with the arteries. The arteries which are present here are the brachiocephalic artery, the left common carotid and the left subclavian artery, which are arising from the arch of aorta. So arch of aorta with its branches are all present in the superior mediastinum. Then coming to the veins, we have got the right and left brachiocephalic vein which are uniting to form the superior vena cava. So the upper portion of the superior vena cava is present here. And then we also have two tubes, one is trachea, other one is the esophagus. In between the trachea and esophagus there is the left recurrent laryngeal nerve. The other nerves which are present are phrenic nerve. Then we have got a cardiac plexus of nerves. We also have got the vagus nerve which is present as the content of the superior mediastinum. Also we have got the thymus, the thoracic duct and the lymph nodes, namely the paratracheal lymph nodes, bronchomediastinal lymph nodes and brachiocephalic lymph nodes. Okay, now these are the contents. Now just now I said there is something called mediastinal syndrome. The patient is coming and telling you in conditions of bronchogenic carcinoma, if the person is having cancer of lung, in simple word, cancer, lung cancer or bronchogenic carcinoma, or in case of Hodgkin's disease, okay, in case of Hodgkin's disease or Hodgkin's lymphoma you can call, in case of the Hodgkin's disease, Hodgkin's lymphomas, in these conditions there is a mediastinal syndrome which is occurring. Mediastinal syndrome. Now what is this mediastinal syndrome? Let us learn. Okay? Let us learn what is this mediastinal syndrome. The patient who comes to you, imagine there is a growth, a cancerous growth which is seen in the region of the mediastinum. We have learned in the right side we are having veins and in the left side we have the arteries. The tumors, they are growing more towards the right side because the veins are present. Around the veins we have got dead space. Whenever there is increased venous return, the veins they enlarge because there is dead space present around it normally. The arteries really don't expand, but veins do expand because their walls are made up of collagen fibers. The veins they expand. And this expansion is permitted because of the presence of dead space. As a result of which, if there is any cancerous growth, the growth is growing more towards the right side. The growth of that cancerous lesion is growing more towards the right side because least resistance is offered to it. That time, when the growth is growing towards the right side, what all can happen? When the trachea is compressed, the patient will have condition called as dyspnea. What is dyspnea? Difficulty in breathing when trachea is compressed. When esophagus is compressed, the patient will have dysphagia. What is dysphagia? Difficulty in swallowing. Difficulty in swallowing. Dyspnea is difficulty in breathing. And when the left recurrent laryngeal nerve that is present in the tracheo-esophageal group, when that is compressed, then the patient will have dysphonia. What is dysphonia? That is the voice had changed. The tone had changed. The patient will tell, now my voice is hoarse. There is a change in my voice, and that's what you call as dysphonia. Imagine if the superior vena cava is compressed, then there is dilatation of the veins seen on the face. You know, superior vena cava is draining the blood from the face and the neck. right, into the right atrium. So if this superior vena cava is compressed because of that cancellous growth or the space occupying lesion, what is happening? Dilatation of the veins on the face and on the region of the neck. You will be shocked to see, oh my god, all these veins on the face and neck are dilated or distended. This is because of superior vena caval obstruction. Also, if there is, we have got the phrenic nerve here present in the superior mediastinum. So if the phrenic nerve is compressed, there is paralysis of the diaphragm on that particular side. You have got the right phrenic nerve and the left phrenic nerve which are supplying the right half, the right dome of the diaphragm and the left dome of the diaphragm. So if the phrenic nerve is compressed, then the patient will have unilateral paralysis of that particular side of the dome of the diaphragm if phrenic nerve is compressed. Are you understanding? And if it is compressing the vertebral column, one of the vertebrae, imagine it is compressing, the lesion is compressing, then there will be erosion of the vertebral body. There will be erosion. So if you see the normal vertebral body which is like this, slowly it will be eroded. Erosion of the vertebral body because of that tumorous growth is also possible because of the continuous compression caused by the tumorous growth. Are you able to understand? And in the region of thorax we have got the nerves. So these intercostal nerves, if they are being compressed, then at that region it will cause intercostal neuralgia. So the patient will come to you and tell, doctor, you know what happened? I am having pain in the region of this side, then I am having change in my voice, then I am having difficulty in swallowing, then I am having change in my voice, then again these days I am finding it is very difficult to breathe. Also my family members noticed on my face the veins have been dilated and distended. They are telling now we are seeing veins on your face. So like that he is telling so many complaints and they are all true. You are understanding? Don't be careless when you are taking the history. What that fellow is telling. Because we have seen good number of times people are developing this attitude. Kindly don't develop. Please understand that we are dealing with the patients who are already suffering, who are already in pain. So let us be kind to them and let us try to understand what exactly is the problem. So the mediastinal syndrome, what is it presenting with? So the tumorous growth, for example in case of Hodgkin's lymphoma or bronchogenic carcinoma, when the tumorous growth is growing, it will grow more towards the right side because dead space is available around the veins. And this can start compressing the trachea, causing dyspnea, compressing the esophagus, causing dysphagia, difficulty in swallowing, compressing the recurrent laryngeal nerve, causing dysphonia or hoarseness of the voice. And then when it compresses the superior vena cava itself, it is going to cause dilatation of the veins of the face and the region of the neck. And also if the phrenic nerve is compressed, it will cause problem with the movements of the diaphragm. Okay? Now let us quickly revise about the superior mediastinum. So let us begin with the boundaries of the superior mediastinum. The boundaries of the superior mediastinum are: anteriorly it is the manubrium of the sternum, posteriorly it is the fourth thoracic vertebrae with the intervening intervertebral disc forming the posterior boundary. If you see the inferior boundary, it is formed by an imaginary line that is drawn from the sternal angle to the lower border of the fourth thoracic vertebra. Superiorly, if you see, there is inlet of thorax. So these are forming the boundaries of the superior mediastinum. Now coming to the contents of the superior mediastinum. So we have got the muscles, sternohyoid, sternothyroid and longus colli muscles which are present. That is origin of sternohyoid, sternothyroid and small portions of longus colli are present in the superior mediastinum. We are having two tubes, trachea and esophagus. In between these two tubes you have got the left recurrent laryngeal nerve. We are having phrenic nerve, cardiac plexus of nerves also present in the region of superior mediastinum along with the vagus nerve. We have got the arch of aorta with the brachiocephalic artery on the right side, left common carotid and the subclavian veins on the left side. Also we have got the right and left brachiocephalic veins which unite to form the superior vena cava. The upper portion of the superior vena cava is also present in the superior mediastinum. Then we have got thymus, that is the remnants of thymus. You can tell a small portion of this of thymus, a small tissue of thymus, thoracic ducts, and the thoracic duct and the lymph nodes. Very important are the lymph nodes which are present here in the superior mediastinum. We said there are paratracheal lymph nodes, and then there are the bronchomediastinal lymph nodes and the brachiocephalic lymph nodes which are present. And please understand, I said thymus is present in the region of the superior mediastinum, but you know, in elderly people the thymus is degenerating, it is disintegrating. You know, there is involution of thymus after a certain age. It is not present till we live. Okay, it is only during the puberty. Up to puberty it is present. After puberty it shows involution. Okay. Then coming to the Mediastinal Syndrome. So we have learned if there is a tumorous growth, especially like your Hodgkin's lymphoma, the bronchogenic carcinoma, or whatever is let it be a cancerous growth, whatever it is. It is going to occupy more of the right side of the superior mediastinum, because in the right side we have got veins, and around veins we have got dead space. Okay, little loose areolar tissue which is permitting the distension of these veins when there is increased venous return. The veins, they dilate when there is increased venous return, but arteries, they don't expand. Veins do expand because of the presence of collagen in the tunica adventitia, and you know, superior vena cava is a large vein. 70% of the venous wall is formed by the collagenous tissue. Okay, so this is expanding because of the presence of the dead space. Into this dead space, invading, we have got the tumors, and these tumors, in the process of their invasion, they are going to cause a great symptom complex called the Mediastinal Syndrome. Whichever structure they are going to compress, it will cause a lot of disturbance to the patient. If the trachea is compressed, it is going to cause dyspnea. If esophagus is compressed, dysphagia, difficulty in swallowing food. If left recurrent laryngeal nerve is compressed, it is going to cause dysphonia. The phonation of the person will change, the voice will change, it will cause hoarseness of the voice. If it is compressing on the vertebral column, then it will cause erosion of the vertebral bodies. Okay. If the intercostal nerve is affected, it will cause intercostal neuralgia. So that portion of the chest wall is paining for the patient. And if superior vena cava is obstructed, then the veins on the face, they will distend, they will dilate, and you can appreciate this distension of the superficial veins present in the region of the neck and face. Is that fine? Are you able to understand? Now, some more points you want to learn clinical anatomy. Is it interesting? Good. If you are interested, now I am going to tell one more thing. If you see the deep cervical fascia, now you know we have spoken up to the first thoracic. We are talking about the thoracic cavity, so we started from the first thoracic vertebrae. But if you go up, what are you having? The cervical vertebrae, that is C7, C6. So you are having the cervical vertebrae. Now if you take the deep cervical fascia, one layer of the deep cervical fascia is called the prevertebral fascia. So here you are having the prevertebral fascia. This prevertebral fascia, which is starting from the region of neck, that is the cervical region, will come up to the level of fourth thoracic vertebra. Are you understanding? The prevertebral layer. What is pre? In front of, just before the vertebrae, you have got a layer that is called the prevertebral layer. It is beginning from the neck, that is the cervical region, and extending up to the level of fourth thoracic vertebra. So, what do you understand? If there is collection of pus in the region of the neck, it can trickle down. Okay, if there is collection of the pus, it will come down up to the level of fourth thoracic vertebra. Not outside, it is this way here. So what is happening here? There is collection of the pus in the region of the neck to begin with. Slowly it can gravitate into the level of, or up to the level of fourth thoracic vertebra in the superior mediastinum. So infections of the neck can extend into the superior mediastinum, but not below this. Not below, you don't have the infection extending only till here because of the prevertebral layer. Till there, it is going to extend. Of course, if there is negligence on the part of the patient and is not taking treatment, yes, anything can happen. Anything can happen if you are negligent. You are understanding? We are just telling infections of the neck can spread up to the level of superior mediastinum. This is because of the prevertebral fascia that is being present. Okay? Thank you. Thanks for your patient listening.